Okay, so if you're a new parent, this is one of the very first and pretty big medical decisions you're going to face for your newborn son, whether or not to circumcise. And wow, is it a loaded topic. It's just full of medical data, really strong opinions, and some pretty deep cultural and ethical questions. So today, we're going to try to untangle it all. We'll look at the official guidance, the data behind it, and the arguments from every angle.
So welcome to the Lenny and Maria Sanchez podcast and video show. Let's break this down piece by piece.
Here's our roadmap. We're going to start with the official stance from the biggest pediatric group in the US. Then we'll actually quantify the benefits they talk about and take a really honest look at the complications. From there, we'll pivot to a critical perspective that questions the data, dive headfirst into the core ethical debate, and then finally, we'll pull it all together and see how a parent might actually make this decision.
To really get a handle on the mainstream medical view here in the States, you have to start with the American Academy of Pediatrics, or the AAP. Back in 2012, they put out their latest policy statement on this whole topic. And here it is, the core conclusion. After going through all the research, the AAPB basically said, from a health standpoint, the pros outweigh the cons. They also make a point to say that this balance means the procedure should be available for any family that decides they want it. So what exactly are these benefits they're talking about? Well, the AAP zeroes in on three main things. We're talking about a significant drop in urinary tract infections when they're infants, a lower risk of penile cancer, which is already very rare, and later in life, a reduced chance of transmitting certain STIs, including HIV.
But, and this is a really important but, this is not a blanket recommendation. The AAP is not saying every single baby boy needs to be circumcised. What they are saying is that the benefits are solid enough that it's a medically reasonable choice. The ultimate decision? That's left up to the parents, so they can weigh the medical facts alongside their own beliefs, be they cultural, religious, or personal.
Okay, so that leads us to the next big question, right? How significant are these benefits we're talking about? To answer that, we've got to look at the numbers, especially around that most cited benefit, preventing UTIs.
Check this out. A 2018 study that dug into thousands of insurance claims found something pretty striking. They saw that neonatal circumcision was linked to a 75% lower rate of urinary tract infections in the first couple of years of a boy's life compared to boys who weren't circumcised.
Now, this slide introduces a really helpful concept from the world of medicine called the number needed to treat, or NNT. It basically tells you how many people need to get a treatment for just one person to get the benefit. So that same study figured out you need to circumcise 37 baby boys to prevent just one UTI. That number gets smaller, down to 25 to prevent one related medical issue, and it's just 17 to prevent one urological scan, like an ultrasound of the kidneys. Of course, you can't talk about benefits without taking a hard look at the risks. It's two sides of the same coin. So now, let's turn our attention to the potential complications that can happen with the procedure itself. A big study from a Kaiser Permanente hospital looked back at over 2,700 circumcisions done over 10 years. And what they found was that the overall complication rate was really, really low. As you can see, almost 99% of the time, everything went perfectly fine. Only about 1% needed to follow up with a specialist, and a tiny, tiny fraction of those actually needed a surgical revision later.
And what's really interesting is that the study highlighted two key things that can influence those risks. First, the type of surgical clamp they used made a difference. They found the Gomco clamp had a lower complication rate than the Mogan clamp in their hospital. But maybe even more important, they found that complication rates were cut by more than half after the hospital started requiring doctors to perform at least 20 procedures a year. That really suggests that the experience of the person doing the procedure is a huge factor in safety.
But not everyone in the medical world is on the same page as the AAP. Critics have brought up some really important questions, not just about the data, but about the whole idea of how we even do this risk-benefit analysis in the first place.
For example, here's a point made by the American Academy of Family Physicians. They basically say, okay, sure, circumcision might reduce UTIs, but hold on a second. These infections aren't very common in boys to begin with, and when they do happen, we can almost always treat them with antibiotics. So this really calls into question whether it's necessary to do a surgery to prevent a condition that's pretty minor and treatable.
The critique goes even deeper, though. An article from 2015 argues that the whole framework of just balancing health benefits against surgical complications is kind of flawed because it's missing a huge piece of the puzzle.
This perspective makes a powerful argument. It says that the risk shouldn't just mean the small chance of a surgical mistake. The risk should also include the guaranteed outcome of the procedure, which is the removal of the foreskin itself.
The argument here is that the foreskin isn't just extra skin, it's a healthy, functional, and sensitive part of the body, and so its removal should be counted as a harm in the ethical equation, not just a neutral event.
And that way of reframing risk leads us straight into the core ethical dilemma at the absolute heart of this decision. You see, this isn't just about statistics anymore. It's about fundamental principles like consent and bodily autonomy.
When you lay the ethical arguments out side by side, you can really see the conflict. On one side, you have this deep respect for bodily integrity. The argument is that it's just not ethical to perform an irreversible surgery that isn't medically necessary on a person who can't consent, especially when it removes functional tissue. But on the other side, you have the argument for parental rights, that parents should be able to make decisions they believe are in their child's best interest. This side says the medical benefits are real, waiting until adulthood means missing out on some of them, and the procedure's actually riskier later in life.
So, where on earth does this leave parents? I mean, you're faced with official guidance saying the benefits outweigh the risks, you've got compelling critiques of that very data, and then you have this profound ethical debate. How is anyone supposed to make a clear choice with all of that swirling around?
Well, patient education materials like this one from UCSF Health try to just boil it all down. They lay out the pros, that slightly lower risk of UTIs, some STDs, and penile cancer. And they lay out the cons, the immediate, though rare, risks of surgery, the potential for decreased sensitivity, and the very real point that good hygiene can also prevent many of the same things the surgery is supposed to.
And in the end, after all the data, all the debate, we land right back where we started. All the major health organizations in the US, from the AAP to the CDC, they all agree on one fundamental thing. This is a personal choice for the family. The science just doesn't give us a single, definitive answer that fits everyone.
And that leaves all of us with a final, really challenging question that goes way beyond the single procedure. It forces us to ask, how do we as a society balance two powerful and often competing ideas? On one hand, we want to use medical science to prevent disease for the population as a whole. But on the other hand, we have the fundamental right of every single person to control what happens to their own body.
It's a decision that really highlights a fundamental tension in modern medicine. Thank you for listening to another session of the Lenny and Maria Sanchez podcast and video show, produced and archived at the website notebooklmvideos.com.